Recording it.
Wait.
You're on.
Okay. Wait. All right. So, thanks everybody for being here. My name's Carrie Wallace. I'm the board chair for Whole Washington. I've got a slide to introduce myself, but I wanted to first just say welcome and thanks for coming. This is our last scheduled event in the official spring summer road trip 2024. It's been an exciting journey for us, and we'll talk a little bit about our learnings from the road as we go through the slides. So this is a special event. You're going to get a little bit of the content that we shared in those meetings, town halls all around the state, and you're also going to get a little bit of learnings and some thank yous and recognition and those kind of pieces that I think are super important. Lots of work went into this journey and all of the stops along the way. And there's been some really important volunteers supporting this work along the way, both in local communities and behind the scenes. So we'll do some recognition and we'll introduce ourselves and we'll talk about the Washington Health Trust and then how we can get better healthcare in Washington State. And then hopefully if we can get it done here, the idea will spread. It'll work so well that all the other states will want to do it. We can have a national plan. That would be ideal. So I'm giving away a few things in the intro, but thanks for being here. And with that, hopefully I can advance the slide. There we go. So my name is Carrie Wallace. I'm a nurse by background. If you registered, you should have an email in the system now tied to this event. And so you'll get an email afterwards giving you a copy of these slides. So you'll have our contact information, both our personal contact information and then the campaign email address if you're interested in shooting us questions later or giving us some ideas or getting something started in your local area. We'd love to hear from you. So I've been a nurse for 20 years. I am a dues-paying member of WSNA and National Nurses United. My current position is not represented, but I believe in collective bargaining. I think that strong workplace democracy leads to strong democracy in our country. And so I do pay dues to both of those organizations, WSNA at the state level and then National Nurses United, because they are heavily invested in the fight for Medicare for all and a federal single payer solution. So I do what I can from Washington to support their national efforts. I've been a volunteer since it's really more like 2017 when I built these slides. It's hard to remember back that far, but listening to everybody talk as we've been doing this journey, I'm like, maybe it was 2017. But I did meet Georgia and others at the Healthcare Now conference in late 2016 in Portland, and I think my life's been changed since then. After the Bernie Sanders campaign, I was looking for a place to put all this energy and found Whole Washington. I collected a whole 7 signatures for the first initiative, but it was 7 they didn't have. So, and then I've grown since there. I was a signature captain with our most recent campaign, and I live in Cowlitz County. So the Cowlitz County team collected over 2,000 signatures with that initiative. And it's a challenging conversation sometimes in the less blue, little more purple areas of our state, little red, my neighbors are. So but healthcare is an absolutely everybody issue. We are a nonpartisan organization. We'll talk about that. And this topic is important to everybody. Everybody wants to live a long, healthy, well life. So, and they want that for their families. We've been sharing our stories on the road. Hopefully you'll have a chance to feel brave to share yours as we go through these slides. So I'll start with mine. The one I've been sharing most often is about my uncle. He passed away in March. He had been diagnosed with colon cancer about 7 years ago and went through treatments, fought his cancer, was living with cancer in remission for a number of years until the insurance companies decided that his medication that was keeping his cancer at bay was too expensive and they weren't going to cover it anymore. And so my uncle was the primary insurance for their household. He had to continue working while he fought cancer for the second time. because he couldn't afford to not have insurance going through the cancer journey again. Cancer came back to his colon, came back into his lungs. It metastasized into a tumor in his throat. And because he had to keep working, he taught his classes. He was a communications professor on the East Coast. He taught his classes at a whisper while he recovered from that surgery, and then was like literally grading papers on his deathbed because that's what he had to do. So, and it's gross, it's tragic, it's not unique. My family story is unfortunately very common as we look at the state of healthcare in our state and across the country. So we're hoping that folks will get connected on a heart level and really get in excited or infuriated or whatever it does to light your fire to help us make a difference in this space. So with that, I'm going to turn it over to Catherine to introduce herself. Go ahead, Catherine.
Yes, I'm Catherine Lewandowski, and I've recently retired, worked as a registered nurse for about 33 years and 5 years as an LPN. I was always active in my local unions in my early years of my career on negotiating teams as a shop steward and was the chair of my WSNA local unit. But honestly, I realized within the first 5 years of my nursing career that we were just doing healthcare all wrong in America. And I was truly inspired by the Sanders campaign because that was the first time I actually had ever heard an elected politician saying all of the things that I truly believed to be true. There was just a ton of waste, and we could just do so much better. I don't have any kind of a personal story really, and all of them are kind of long. I have tons of um, stories that probably would gross most of you out. I think it's just the most frustrating thing to me is seeing how hard the people in the middle have had to work. They get no support because they make too much money, and yet they don't make enough money to afford their health care. So when they do come in, things are so advanced that they really just do what we can to keep them comfortable. The other frustration I think too was seeing when I worked a lot of years in intensive care, and we waste so much money in intensive care on things that we could have just taken care of early, and people could have gone on to have long, productive lives. And instead, we're throwing all of this traumatic work and energy into trying to save their lives and not getting any kind of true benefit out of it. It's just kind of a waste of everybody's time and energy and causes undue suffering on people. We can just do so much better than that. So I'll stop there.
All right, thanks, Catherine. Is Jane on tonight? I don't think Jane's here tonight. Jane came with us on the road. She told a story in her intro around, taking a poll of college as a college student in the Spokane area. And that even back then, overwhelmingly, folks were in favor of a universal healthcare type system. And something that surprised her being in that area and that she's carried with her all this time. Her sister was amazing connection out on the east side of the state, and her friends were super welcoming with their accommodations as we were finding places to stay. So just can't thank Jane enough for her participation in this. And Pam is here tonight. Pam, you want to introduce yourself?
Hi, everyone. I'm Pam, a retired nurse of 40 years, and 30 of them in hospice, which I consider my true calling. Of course, I couldn't stay retired, so I did COVID vaccines for 2 years, and then became a whole Washington volunteer in 2020. I think I did one day at a park with my friend Lana in that picture. I mean, a farmer's market, and then the next day it was shut down. Everything was shut down. Signature Campton, that's where I was available to people here in Tacoma area and helped out with that. And what I really noticed that people were rationing their medicines when I would see them. They were already in medical debt. And I just realized we really need a a more equitable healthcare system and in our wonderful state of Washington. Thanks.
All right, so why are we doing these town halls? We stole this idea from a successful campaign in Michigan. They took on gerrymandering with their initiative process, and now they have a citizens board that draws their maps. So neither party is able to draw weird lines, have advantages. And the citizens, those that are maybe independent, et cetera, have some say in the democracy of their state. And so we spoke with those organizers and asked some questions. The Slay the Dragon movie is a good one, but it didn't cover like how were they so successful. They collected like 50,000 signatures in the first 2 weeks. They had their 400,000 signatures a month before the deadline. And we've done this 3 times. We've collected about 100,000 signatures 3 times, and we know how difficult that is. So you know, they had media attention saying, oh my gosh, these guys are everywhere, right? And that's really what it takes to win. So we picked their brains about how they got to that place where they were doing so well. And the town hall road trip was one of the strategy they gave most of the success to, just being in local communities, opening conversations with folks who'd never heard of this before and you know, wanted to have an opinion and be included in the process. And so it's a really very inspiring story. We've met with those organizers several times about how to use our data systems differently and how to organize ourselves better and how to be more responsive and those kinds of things. But this town hall road trip was an idea we definitely stole from them, and it's been very successful overall. So you know, we're talk about some of the learnings, but overall we've seen that folks around the state are experiencing the same challenges, and I'm sure some of the stories that are coming from the road will resonate with the group in tonight's event as well. Goals from the town halls. We're hoping to educate the public about the state of universal healthcare fight in our state. There is a Universal Healthcare Commission. They meet monthly, whether it's the commission or their subcommittee, the Finance and Technical Committee. It's a definitely a worthwhile platform for participating in this conversation. We'll talk about it some more later, but you know, you can give 90 seconds is all it takes to give public comment. You can email them at any time to tell your story. And we'll talk about the importance of telling your stories, because we're going to talk about facts and figures, and you know, there'll be some slide deck, you know, graphs and those kinds of things. But that data is not what's going to get your representatives to change their minds and do their jobs differently. It's really, you know, telling your story and connecting on a level that's bigger than the money campaign funds that they're potentially taking from the medical industrial complex. So, so to get them to get on board with the Washington Health Trust that we'll talk about, the Universal Healthcare Commission is a platform for that conversation. Their entire purpose is supposed to be providing our legislature with clear policy guidelines, clear policy instruction around implementation of a state-based single-payer healthcare. So the work group that existed before them really focused on a Model A, publicly funded, no insurance companies, similar to what the Washington Health Trust is offering. So we'll talk about that. We'd also love to create opportunities for discussion. We'd love to better understand public thoughts around this issue and collect some feedback. So every time we have an opportunity to submit our bill language, whether that's as a bill or as an initiative, we take that opportunity to vet the policy language through different organizations, and we have that opportunity now. So hoping to connect with folks in communities that maybe this policy bill initiative, you know, policy review is your brand of nerd. That would be amazing. Like, we want to hear from you. Maybe you're a small business person and we get to the conversation around how this impacts small business and you have some ideas on how this could work. So hoping to just have an opportunity to collect some feedback. And then again, I talked about, connecting with the issue, getting excited, maybe getting super pissed about the reality of it and wanting to make a difference. So hoping to see us continuing to build a coalition of active volunteers and organizations ready to help us collect signatures with our next initiative. We want to repeat Michigan's success here in Washington with healthcare. So the same way they were able to do their thing with gerrymandering in Michigan, we'd like to do that here in Washington. As we've been on the road, we've had several partners on this journey. The League of Women Voters has been one of those partners. They co-hosted with us in Clark County, a couple of town halls in the Vancouver area, and then also the Whatcom County League of Women Voters helped us co-host one in Bellingham. I'm not going to read this slide to you, but just so you know that the league's position, they're not neutral on this topic. They are nonpartisan, and they've taken a strong position in favor of a universal healthcare system and in support of the single payer concept as a viable option for this. And so it was really just great working in collaboration with the league in those counties. Inspiring group of folks for sure. So who are we? Maybe you've heard about the league, maybe you haven't heard about Whole Washington. So let's talk about Whole Washington for a second. We are a grassroots, nonpartisan organization made up of regular working people. Our board has had in its history and current a lot of healthcare professionals. We've also had a lot of folks who don't have healthcare backgrounds, who just have experienced the healthcare system and want to make a difference. We were founded by Kathy Angel, who does happen to be a nurse. Unfortunately, she passed away during our first initiative, and Georgia Davenport was part of the leadership at the time and really helped hold Whole Washington together as the leadership and the primary volunteers were really mourning Kathy's loss. So I mentioned we're centering stories. We'd like to share Georgia's story, and we're going to let her tell you that herself via this clip from the Healing Us movie. This documentary is great. It's narrated by Susan Sarandon. Kenny Ballantyne's the director. It's super cheap to watch. It's like $3 on Amazon and $1.50, I think, on Kinema. Really recommend it from a organizing perspective. It makes the case for single payer. It makes the case for kicking the insurance companies out. It makes the case for why we don't have this already because of the big money in politics. And so, Healing Us. This is Georgia's story.
Before my husband and I were married, we lived in New Mexico. We got pregnant, and New Mexico, this is before the ACA passed, but I think it's probably still the same. The insurance companies allowed a small Medicaid expansion for pregnant women and then their children, if their children were born. But as long as the child was still alive, the child would be covered. So because I made a little bit too much money to be on full-blown Medicaid, I was working at a shoe store. So it's interesting that I was still above the federal poverty level, which is kind of a joke, it's so low. I wasn't able to qualify for full Medicaid. So I got on this program that allowed my pregnancy to be covered, essentially. And one day, I think I was about 3 months along, I started having severe cramps, and I went to the doctor. And they gave me an ultrasound, and they said that I was having a miscarriage. And what I could do is I could have what's called a DNC, which is I don't think it would be considered surgery, but it's a way to move the miscarriage along so you don't have to go home and go through basically labor. But it would cost $3,000 because my healthcare coverage only covered my child. Well, my child still had a heartbeat. So I said, I don't have $3,000. So I went home, and it took about 4 days, and I had a miscarriage. And then a few months later, I get a call from the hospital's bill collection agency telling me that I owed like $400 to the hospital for the ultrasound, where they told me my baby was no longer viable. So Anybody watching this in other countries, I want you to really, really appreciate what you have, because that doesn't happen in other developed countries. And I think back to it, and one of the hardest parts, I mean, it was all very hard, but one of the most difficult parts was talking to the insurance collector, because he even broke down in tears. He couldn't believe that he was having to call me to tell me that I had a bill because my baby had died. And that's one of the reasons why I really am passionate about this, because I don't want any woman to ever have to experience something like that.
So again, our overall goals, universal single payer healthcare here in Washington, and then an expanded, improved Medicare for all nationally. Something that makes sure we're covering your full body, your eyes and your ears and your teeth, the medications that you need, transfers in an ambulance, all of those things that, you know, make a comprehensive healthcare system function. Hoping to cover that with the trust. So why do we need universal health care? There is a strong correlation between affordable health insurance and your lifespan. So your ability to live a long, healthy life without complications of chronic disease and et cetera, really depends right now on your ability to have access to insurance and to be able to afford going to the doctor and seeking care. Because it's expensive even if you have insurance, right? So my son recently had a tonsillectomy. Our out of pocket for his surgery was almost $1,400, and that's with good insurance in Air Bunnies, right? So that ability to afford that kind of bill and not to delay care or ration your medications or you know, just not go because you're afraid of the bills really impacts longevity. This slide is specific to Washington State. Each dot represents a county, but the same is true nationally. So it's very important. On a national level, we spend more than any other country on universal health care. So, you know, this is the United States way up here. And most of the other countries with lines represented have some kind of universal health care system. Some of them are fully government run like the NHS, and some of them are more like what we're proposing, where we're just paying the bills and the providers and the nurses are, you know, part of private businesses that function, but everything's billed into one place. And so it saves money. It decreases administrative burden and saves a ton of money in just duplication and craziness. Is there anyone here who's ever worried about being able to pay for their health care? We heard this as an absolutely common theme around the state. The size of the bills, maybe a hands up or hands up emoji. All right, we have some hands. Anybody willing to come off mute and tell a story about healthcare costs that you've experienced?
Can I step in at this point?
Yeah, go ahead, Mike.
It's not about me personally. My receptionist recently had some medical issues. She was having respiratory problems, and she went to a physician, and it was some type of COVID-related lung respiratory issues that was very rare, and they hadn't seen it. And they prescribed a drug for it that was new and was $2,000 a month, and her insurance turned it down. And so she's experiencing this horrendous health issue already, the stress of having that illness on its own. And then she spent 2 to 3 weeks going back and forth with her doctors and with her nurses, fighting the insurance company, trying to get this claim approved. And finally, they came up with that alternative medication, pharmaceutical, that she could use that they would cover. But it wasn't the best stuff, not what the doctor wanted. It was what they were willing to pay for. And it just is such a crisis situation when you're already so broken down and struggling that your own mental health can make you worse because you're having to fight the cost of what they're trying to put on you.
Yeah, that's an excellent example. Cheryl, I saw you come off mute. Would you also like to share?
Hi, yeah. My most recent medical expense was dental. Chaz couldn't pull a tooth. They sent me to a specialist, and the specialist charged me $5,000, had me open up a care credit line of credit. And then to go back to get it fixed was going to be another $2,500, but they didn't even tell me that when I spent the $5,000 that day on care
Wow.
credit. And the only reason why I'm able to get any mental health care, even though I'm on Medicare, not Medicaid, is because there's a block grant for elders through Frontier Behavioral Health. So you don't have to be on Medicaid to be seen without having to make a $40 copay per week for Medicare.
Wow.
It's ridiculous.
Yeah. Yeah. And it's super common. We're hearing this all over the state. And so we're going to talk about the Washington Health Trust would be better for individuals and families. The fact that United States has $88 billion in collections, and the number one cause of bankruptcies is medical expenses. This is unique to the United States. Most countries.
I did that. I did a medical bankruptcy in 2014, and it will drop off my credit report in December.
Right.
But now I'm sitting here with $7,500 worth of medical debt for 2 teeth.
It's crazy. It's crazy. And so folks are turning to programs like GoFundMe to raise money for their healthcare. There was $650 million typically on an annual basis that's raised through GoFundMe accounts. I know that I've donated to friends' GoFundMes, kids with cancer and those kinds of things, where families just can't be expected to afford the type of services that insurance companies are not willing to pay for, even though they have all of our money, right? They have all our premiums, they have all of our tax dollars. United Healthcare, like 3 out of every $4 of their profit right now is taxpayer dollars. So they have the money, they're just pocketing it right now. There was a RAND experiment that found that a 2% increase in copays resulted in a 10% reduction in utilization. So that's great news for an insurance company who takes all our money up front. Not good news for the rest of us who are just trying to live better lives, right? Be healthy. Catherine talked earlier, if we spent the money preventing healthcare crises versus scaring people into not going to the doctor, we could save tons of money and also have a much more healthy public. Much more healthy public. Is there anyone here who owns a business and struggles to pay for insurance for themselves or their employees? This is another thing we heard pretty much unanimously, the folks that did own businesses in the area. Yeah, Ray, you've got your hand up. Please share.
Can you hear me?
We can.
Okay. Thank you. Just really quick. So I'm semi-retired, sole proprietor. Was in Oregon. I've been in Washington since 2020, and our wages would fluctuate. So sometimes we pay $1,300 a month for Obama, whatever, quote unquote, Obamacare through Kaiser Permanente. Right now we're paying, I think, $200 a month. And I just went to occupational therapy because I'm having some back and hip issues. And that was $400 for the initial visit. And I'm not going to go again until I can figure something out. So there's other stories out there that are way worse than mine, much more difficult than mine. So right now I'm just in that period of like, what in the hell is coming down the road, you know? So anyway, that's all I have to say about that. So, yeah.
Yeah. Thank you for sharing. That's terrible.
Yeah,
go ahead.
I'm sorry, I'm trying to raise my hand, but the Zoom has changed around. I can't figure out where the hell it is.
It's like we had a heck of a time trying to figure out how to share audio earlier. Go ahead, David.
You know, I don't run a business. I mean, I don't own a small business, but I run one. And it's basically impossible. The former owner of the company stopped providing health care or health insurance. I don't know, maybe 10 years ago. And so I think there's a part of our pay is a tax deductible health something or other, but yeah, it's just ridiculous. And you know, you want people to work and you know, how can you be productive if you're worried about your health care and the bills and all that kind of shit? So,
Right.
you know, and also I've been doing mutual aid for the past 4 years, and there's a lot of people out on the streets that could work if they could get their medical issues dealt with.
Right. Yeah, great point. So the Washington Health Trust is better for business. Right now, businesses that can afford to provide health insurance are paying 15 to 18% of payroll to cover insurance. I've heard as high as 22% of payroll. And that cost is variable, right? It fluctuates, it changes every year. It mostly goes up every year. And what they get for their money, what we get for our money, is less and less every year. This is not something other countries deal with, right? We have a majority of folks that have their healthcare tied to their job. About 55% of us have health insurance through our employer. Often folks stay in their jobs just for healthcare. They can't retire. You know, there's a lot of folks who are working well past retirement age because the thought of affording the medical care that one needs as they age is just, it's not happening. It's not possible. So we also saw during the pandemic that folks who lost their jobs because things were closed down lost access to their health care. There was also some expansions of the Medicaid and those kinds of programs, and we had no trouble affording those expansions while the pandemic was happening. So it's a policy choice and one that we could make differently. So we're really advocating that we just do this differently. The Washington Health Trust Board is instructed to create a small business hardship waiver. We've been seeking input from small business owners on what that might look like. We shared a small business one-pager draft recently with the Small Business Caucus of the Democratic Party. Totally willing to share that resource with small business groups. We're planning to take it to the Chamber of Commerce, which is a nonpartisan entity, and to collect that kind of feedback. What would this look like? Could it be a sliding scale? Where does the hardship waiver kick in where folks would be covered by the trust, but they don't make enough money to fund the trust quite yet, where they're starting off in their business or the size of their business, those types of things. So something to think about and something we would love small business feedback on what that should look like. I think the more proactive we are with feeding the Universal Healthcare Commission and those committees created by the trust, the more proactive we are with what we think it should look like, coming from subject matter experts, the better off the design of this is going to be in the long run. You can't legislate all of that. Some of it has to happen after the trust passes and during the implementation phase, but thinking about it ahead of time benefits us. A little bit about unions. Unions spend a ton of time bargaining for healthcare, and they have the same problems we do. It gets more expensive every year. They get less what they're paying for. This slide really is meant to show that, offering healthcare as a benefit maybe isn't as much of a recruitment strategy as they think it is. Folks that are in other countries with higher percentages of unions often are folks that have universal health care. So the unions aren't stuck fighting for healthcare. They're able to take on other challenges, wages, pensions. Retirement does not look like a pension in our country anymore, and that's too bad, right? How can we fix this? So safety concerns, really addressing the needs of the everyday worker is something the unions are good at and are supposed to be doing. And if we're constantly spending our time fighting for healthcare, there's less opportunity for those other topics. So we talked about why it sucks, but why is it so bad? Big money in politics is really the biggest issue. It is legal in our country to bribe our politicians, period. There's no getting around it. The impact of Citizens United just makes it okay. There's also huge bonuses for the insurance companies and CEOs of corporations to save money by denying us healthcare. I talked already about how insurance companies are paid up front. They're paid with our tax dollars for Medicare and Medicaid type programs. They're paid up front with our premiums. And, they get to keep that money if we don't go to the doctor. So networks are a unnecessary part of insurance. It's not necessary for us to have a network. That just has to do with contracts for the insurance companies. The Washington Health Trust would get rid of that piece and save a ton of time, but also open up choice for you to decide which doctor you want to see. I'm going all over the place, sorry. It also hopefully would prevent some of this collusion that's happening, right? So right now, inflated CEO salaries and bonuses, you know, the more they can save money from us not seeking healthcare, denying our claims, those kinds of things, they get big bonuses. There were 7 health insurance company CEOs that raked in a record $283 million in 2021. That's our money that they're spending on third houses and yachts and vacations and those kinds of things, rather than paying for necessary healthcare services or the best case scenario healthcare services, right? So not paying for the most expensive medication that my doctor ordered that Mike was talking about, but paying for a less expensive medication that isn't the primary, not the best quality, those kinds of things. Speaking of meds, we pay more than any other country for the same medications. With the Washington Health Trust, we'd be able to negotiate some of that. Hospitals right now are consolidating. There's a bunch of acquisitions and mergers. That's really impacting the quality of care. It's impacting price structure. And there's a bit of collusion going on between the hospitals and the insurance companies and how things are charged. We had a town hall in Spokane, and Chris Curry wrote a book about all of this. It's available for free on the Healthcare for All Washington website if you're curious to read it. But he really goes into that collusion factor that, you know, the ACA said the federal government's like, you have to spend at least 80% on medical services, right? They don't set any prices. We're not, you know, really regulating the cost of things, but as long as they spend 80% on services, then they're covered. So the hospitals are jacking up rates so the insurance companies can make more money together. It's gross. Anyway, the system's built with all the wrong incentives. Washington State does have a healthcare cost transparency board, which is supposed to be trying to uncover some of this stuff so it could be regulated. But I would argue that no amount of transparency is going to solve the imbalances in power existing right now. We're going to have to take this on. We're going to have to get involved either by pushing our legislators or by collecting 400,000 signatures, get it on the ballot ourselves. We think that the best first step in this scenario is to remove the insurance companies from the healthcare. That saves the most money up front. That money is $5 to $9 billion worth of profit for them in Washington State alone. So we know we have a fight on our hands. I'm going to share another clip from that Healing Us documentary that talks a little bit about this concept of big money in politics and why it's so hard, why we haven't gotten this done yet in our country. Oh, well, if it'll let me click the link. There it goes. And I never get to pick the YouTube ad. Apologies.
It's therapy day today, and I've actually really come to look forward to therapy days.
There we go.
My daughter Shalyn went to the emergency room with my husband, and you know, the first thing they asked her when she got there was, "Do you have insurance?" And Shalyn replied, "No." This sealed Shalyn's fate.
If me and Danny lived in Canada, if me and Danny lived in Mexico, me and Danny would still be living in Canada or Mexico.
One of the hardest parts was talking to the insurance collector because he even broke down in tears. He couldn't believe that he was having to call me to tell me that I had a bill because my baby had died.
The Democrats and the Republicans are both in the pockets of Big Pharma and the insurance lobby.
It's not just one of the parties that's been corrupted by corporate money. It's both parties.
The main reason why we're not where we need to be is because of money in politics.
Ultimately, everything's about the dollar bill, right? So when you have Big Pharma, when you have these mega health insurance companies who basically write the bills for our politicians, of course, it's a conflict of interest. It shouldn't happen.
We pay more in America for our healthcare than almost anybody in the world for worse results.
This is a profit-driven business. Make no mistake in that. And they are duty-bound. They can be sued if they are not acting in the best interest of their shareholders.
The fallout is that they would rather make a sale than take care of a patient. The people in this country know the system is broken.
Medicare for All, with 88% of Democrats and 49% of Republicans and 70% of Americans overall, is an American policy.
We can make this heavy political lift. We can do this.
Do this. I love that. We can do this. I'll mention that it's totally possible. If everyone in our database, there's about 20,000 people in our database right now. If every single one of those people took a single page, filled out signatures, 20 signatures per page, we'd have all 4,000 signatures that we need. So getting all those people to do that is a whole different thing, but it is very doable. We could do this just like Michigan did this. You know, it's faster if our legislature would do for us. You know, if the commission would provide strong policy guidance and the legislature passes it, that's way faster than collecting 400,000 signatures, but both ways are absolutely possible. And why it's so important is on this slide. Everyone has a story. We've talked about medical debt, surprise bills, and out-of-network costs. You can go to an in-network hospital and end up with an out-of-network physician bill. It happens a lot in emergency rooms. It happens a lot and it's just stupid. It's not necessary. We talked about folks avoiding care due to cost. I mentioned, you know, ambulances are covered. People are taking Ubers to go to the hospital because they're afraid of the bill that'll come with the ambulance. That is not safe for the patient. That's not safe for the Uber driver. That's just stupid. And we should not be putting up with this, right? So why are we putting up with this? We talked about how difficult it is to implement a care plan. So doctors are fighting with insurance companies to just implement a care plan. And all that time spent on the phone is often talking to folks who don't know anything about medical care. They're clerical people doing their job as best as they can, but they are mispronouncing the words. They don't know the diagnoses. They don't know the medication. It's really inappropriate that that's what the process looks like. And it's an absolutely unnecessary part of the process. We could eliminate all of that. The healthcare trust would just pay the bills. If your doctor deems it medically necessary, writes the prescription, orders the treatment, the healthcare trust would pay the bills. And all of that waste impacts every other aspect of the healthcare system. So there's huge staffing shortages right now. Some of that's just plain burnout. Doctors and nurses are tired of, slamming their heads against the walls because of the way our systems are functioning right now. And it's absolutely not necessary. We also, like I said, could just save a ton of time. Doctors could see more patients if they weren't spending the time fighting to implement their care plans and get paid. Because there's a fight on both ends right now, right? We have a fix. So we've talked about all the problems. I've alluded to some of the benefits of the healthcare trust, but we're going to focus on that for now for this section of the presentation. The Washington Health Trust has not been implemented yet. We get that question periodically. Why aren't we doing this? Where are we at with this? We've had a bill go in through the Senate on the last 3 legislative sessions, which is the last 6 years in a row, and we've not gotten a hearing. So the first time we put it in, we said, hey, they told us there was not enough public support. So we rallied around and phone calls and emails and yada, yada. And then they said, oh, well, we want to do this through the commission. So we've been participating heavily in that commission work. It hasn't created a space where we've had a hearing yet. So 3 initiatives we've run also. I mentioned we've collected 100,000 signatures all 3 times. Why is it important to participate in these processes? Because the Washington Health Trust will cover every resident of Washington state, regardless of employment, regardless of housing situation, regardless of marital status, regardless of gender, age, et cetera, right? It's going to cover everybody. It'll put you and your doctor back in the driver's seat. So instead of the insurance companies dictating what care looks like, you get to decide which doctor you go to. Your doctor gets to decide what their care plan looks like, and the trust just pays for it. We're getting rid of the unnecessary networks and middlemen and bureaucracy that comes with insurance. They're not bringing anything to the table that's worthwhile. Gives you the freedom to truly shop around. So if you don't like your doctor, you can go find another one. If you do like your doctor, you don't have to worry about your job changing or your job changing the insurance company's coverage that you have, or the insurance company changing the, the plans that are available and changing your network and those kinds of things. You can shop around and pick the doctor that you want to see. Like, this is truly capitalism, right? So a lot of times, we get questions about, is this socialist policy? No, it's not. We're just paying the bills. We're not providing employment to the doctors and nurses. And if you think about it, having the freedom of choice is definitely a capitalist thought process. I will mention, though, that Dr. Jarvis in the Healing Us documentary does a really good job of explaining why market principles do not apply to healthcare. That I'm not diabetic, so it doesn't matter how cheap insulin gets. I don't need it. I'm not going to buy it. But if I were diabetic, it doesn't matter how high you jack the prices, I'm going to have to buy it, right? And that's what we're seeing in our country now, is they're jacking up the prices of insulin and EpiPens and things people need to survive because they can, because the market principles, the invisible hand is not going to regulate this. It doesn't apply. It's comprehensive coverage. The Washington Health Trust covers your whole body, your eyes, your ears, your teeth, medications, and all at the same time. All of this still saves $5 to $9 billion a year. We've done a couple of financial studies. We also have looked at the financial study that has been put together for the Universal Healthcare Commission. All three of those studies show significant change in savings with this type of model. One of the things to note is that if we kept the system the same and all we did was cover who's covered now, pay for what we're paying for now, we would still save $16 billion a year. But because we extend the types of coverage, the services, and extend it to every resident in Washington, we're only saving $5 to $9 billion a year. That Universal Healthcare Commission study showed a $2.5 billion savings for the first year of the implementation. And if you think about it, that first year is like the messiest year when you're standing up a new program and going through that transition. And even in that mess, still saving $2.5 billion that first year. So it's pretty impressive. Sorry, talk a little bit about how we designed the Washington Health Trust. The language, these links are live, so when you get the copy of the slides, you can go in and look at these. It's also available on our website. We started with the Washington Health Securities Trust bill that was introduced by Healthcare for All Washington a number of years ago, and then we added to it. We took inspiration from one of the Medicare for All legislations, HR 676, and we also looked at Healthy San Francisco as a model. So far, the Healthy San Francisco laws, they've held up to legal challenge. So we're expecting that we would see the same with our bill. I mentioned earlier that we do vet this language through different policy committees, et cetera, in between in between submitting it as a bill or an initiative. And we have had it vetted through the Employment Security Department, the Washington State, and the Washington Department of Revenue. So it's good sound policy with good financial backing. This is one of the Friedman studies available here, available on our website. We also have an excellent FAQ page. So when I'm out collecting signatures and people ask me questions, if I can't answer them, I almost always can find the answer in the FAQ section. So highly recommend it as a resource for folks, especially folks that are excited about volunteering with us. It's really great. So here's what's covered by the trust. It's all the things your doctor orders as medically necessary for your care. Inpatient, outpatient treatment, dental. Right now, most dental insurances cap out at about $1,800, $2,000. That's like one tooth. And we heard from Cheryl earlier, 2 teeth can cost a whole lot more than that. it would just flat be covered by the trust. There's plenty of money in the system. Behavioral health is covered. There are no deductibles. There's no copays. We don't want people afraid to use the system. We want people to get good preventative health care, live healthy lives, and not end up, dying early. There's no out of network. We talked about that. There are some prescription drug copays if you want a brand name drug where a generic exists. And I know that for some folks, the brand name just works better. They are more expensive, and reality is that that's just the way it's set up, but that's capped at $250 a year. So even that tiny bit of cost sharing is insignificant compared to what people are paying right now. Children are covered. Out of state's covered. So if you snowbird or if you go visit your family on the East Coast, like I do sometimes, and something happens while you're there, whatever medical care you have provided to you is covered by the trust. There is paperwork involved because somebody has to bill the trust, but there's no prior authorization process required. It's not complicated. The bills just get paid for. It does not cover out of country. So get your travel insurance. Rehabilitation's included. It does cover Medicare premiums for folks that are 200% of the federal poverty line. We've found out recently we could increase this number to 300% of the poverty line. So something that we're considering for the next version of this. And again, all of this coverage meant to mimic good union benefits, right? And be fully comprehensive and take good care of folks, still saving over, $5 to $9 billion a year based on several studies. So how do we pay for this? I mentioned there's money in the system. We're saving a ton of money, but at the same time, there does have to be a funding stream. It is a payroll tax. Employers are used to contributing to your healthcare already. They will continue to contribute. Folks that are working will continue to contribute. It just doesn't go through the insurance companies. It goes straight into the trust, and all that money is used for our healthcare instead of all the other things we talked about. It's 10.5% of wages, which if you remember previous slide, businesses are paying on average 15 to 18% of payroll right now. So this represents a significant savings for most businesses. Regardless of FTE status though. So businesses who are maybe playing with schedules, so folks only get 32.5 hours or whatever, and they don't have to cover benefits. This is payroll period, regardless of FTE status. So for every employee they have on their books covered by the trust, they need to contribute. They can delegate up to 2% of that to their employees. So that would mean as an employee, I would pay 2% of my wages, significantly less than what I'm paying right now in premiums. And then there's no copays, no deductibles, none of that other out of network BS, et cetera. So significant difference reduction for most Washingtonians. There are some folks, we used to have a savings calculator, we're trying to get it back on the website, that would pay a little bit more or would pay basically the same depending on what income bracket they're in. But for the most part, folks are saving money. Sole proprietors, it's 2% of earnings, and that's profit after the first 15,000. And this again is a place where we're looking for feedback on what does a hardship waiver look like, or what would a sliding scale potentially look like for businesses and sole proprietors who are just getting started. I think this could be a really worthwhile incentive for starting a new business and entrepreneurship. And so we want to make sure that the system's set up to support that as well. And at the same time, take good care of our citizens, our residents. And then capital gains tax. This last piece is not necessary to fund the trust, but Washington has one of the most regressive tax structures in our country. And so people like this. We like the idea of making sure folks who don't have a traditional job and are not being taxed on their wages have a way to contribute to the trust, right? So when they're trading stocks and whatever, then some of that capital gains goes into the trust. If you Google SB 5335, which is our most recent bill number, you're going to see some hit pieces specifically about this piece. They're coming after our houses and they're coming after our retirement. That information is absolutely false. Those specific pieces are excluded from the bill. They're exempt. So home sales, retirement accounts, sale of small farms, small family farms, those kinds of things are exempt from this capital gains tax. So something to think about. There are entities that do not want the system to change, and they are not above putting out false information to scare people away from voting for us or implementing this. So what would that money look like? If you look at the bolded line on this slide, folks earning at the 50th percentile is about $60,000 a year. Annual monthly participation would be about $525 a month. And that breaks up into the ranges in the middle two columns, depending on whether the employer is keeping the entire 10.5% or if they're delegating portions of that to their employees. Typically, there's questions in this space, so I want to stop and just give folks an opportunity to, one, not listen to my voice for an hour and a half, but also get your questions answered if you have any about these pieces. The funding pieces are typically the most asked questions. Anyone? All right, Ray, go ahead. I see your hand up.
Oh, sorry, can you hear me now? Sorry.
Yes, we can hear you.
Great. So as you're going through this is also super quick, I think. As you're going through this, I think my observation is that this actually is very much, well, I think it's kind of operates kind of like a farmer's co-op, maybe, regarding subscription to the co-op and so on and so forth. This is what farmers do, cranberry farmers and other farmers. So my point here is just that in speaking about this to other people, especially rural communities, if the language can be broken down to make it, I always oversimplify things, so it may not be possible. But when somebody says, I really caught on the thing when you said earlier, you get the question, is this socialism, or, that kind of thing?
Right.
That people can get, that can be very reactionary. So if you can say, well, actually, it's very much like a farmer's co-op, or it's similar to this other thing. That's kind of my own.
Yeah, nice.
If it can be tied to something that people already know about, it can be helpful. Anyway, that's all. Thank you.
That's a great observation. And absolutely. I've learned a ton from Dr. Jarvis about talking to folks with a conservative background. Dr. Jarvis is a public health doctor in Utah, very conservative space that he functions in, working and otherwise. And, he can talk about scripture in the Bible that points to the reason why, this is what Jesus would do, right? And so, coming in a lot of times, just having those multiple perspectives and having some language around, meeting people where they are, but not leaving them there. Another quote I'll steal from someone else, right? Yeah, definitely. Making those analogies in ways that folks can understand. I think that's really good, excellent point. Thank you for sharing. Anyone else, question or comment here? Okay, there's room for questions later. So if you have them, so we talked about savings. A lot of the savings comes from kicking the insurance companies out and then the impact of that, right? So there's a lot of simplification for providers. There's a lot of simplification for businesses that have to hunt for insurance plans every year and then administer the insurance to their employees, and all of that work goes away as well. We talked about the ability to negotiate prices, so market power for pharmaceuticals and hospital services and those kinds of things. Gerald Friedman estimates that, Washington is about the same size as the VA, as numbers of people who would be covered by the trust. And the VA saves about 40% on their medications compared to the rest of the country. So it's possible that we could negotiate that kind of savings with the trust. And then at the bottom, that little sliver, there's also the possibility of fraud detection when everybody's billing into the trust. And there are, bad players in every system, and there is probably fraud happening in our medical care community. That's more detectable when everybody's billing to one place than when they're billing to 1,200 insurance companies with 42 plans, et cetera, right? The insurance companies don't really take time to look for fraud. Whatever money they're losing, they just pass that on to us in increase in premiums and those kinds of things. So another benefit of the trust. So Whole Washington's been working with the Universal Healthcare Commission. I mentioned that earlier. There are some opportunities to see someone else talk about this in more detail and a little more depth, also a little more policy wonky. So Andre Stackhouse and Aaron Georgian, one of our volunteers, spoke to the commission in August last year and talked about the details of the policy as well as a vision for implementation. It's about 40 minutes. It's really good if folks are interested in a little more detail than what you got today. And maybe not reading through the FAQ. Sometimes it's nice to just listen to people talk. That is very good. Again, for both the policy and that vision for implementation. What does transition look like as the health trust is implemented and we move away from insurance and we start to get waivers to pull Medicaid and Medicare dollars in and those kinds of things? What does that look like? It's a great presentation. We were also invited back in December to talk about eligibility. It's about a 20-minute conversation. For us, it's really simple. It's everybody who lives in Washington, everybody who works in Washington, college students in Washington. A resident is defined by the healthcare authority. So if you want to see the details of what resident means, you can Google that, but that our policy is based on the definition of the healthcare authority's definition of resident. There are folks on the commission that would rather see us limit this. So folks that are non-residents or non-citizens, to have a much more narrow view of who qualifies. And that's just not that's not a health equity perspective, right? So it's the short answer for us. Everybody in, nobody out. And then we are invited back in March to talk to the FTAC, the Finance Technical Advisory Committee, about finances. That is also a short conversation. And why do we bring this up? It's because, again, this is a great opportunity to voice your opinion, to share what you think, and to hopefully change some hearts and minds. The folks that sit on the commission, there's 2 Republicans, 2 Democrats, and then a handful of folks that were appointed by the governor. They are not all universal healthcare champions. Oregon has a commission as well that's a little more stacked with champions. Ours is going to need some push. It's going to need some push. The Office of Insurance, the commissioner, sits on this commission and can make a huge difference in how the work gets done on this commission. So as you're filling out your ballots, maybe Google who these people are and think about who might be a best fit for the Office of Insurance Commission. Whole Washington does not endorse candidates. They can endorse us, but just Google them. There are some on that list that have very compelling arguments, personal experiences with the failures of the healthcare system and insurance in particular. So there's folks that should stand out there. Same with the governor. The governor appoints a large number of these commission members, and the governor's race can make a huge difference in this space. And that list is long. That's a lot of Googling. But anyway, so has anyone here been impacted by hospital or clinic closures or limited access to specialty care? We heard this a lot in rural communities. On the east side of the mountains, we heard this a lot out at the coast. that, you know, there were 2 eye doctors and one of them died, and now there's 700 people who need doctors and they're driving hours to an eye doctor appointment. It's stupid. There's someone in our rural caucus on rural ag online presentation who has asthma, and his lung doctor, his pulmonologist, is on the other side of the mountains. So hopefully he doesn't need anything from him when it's snowing outside because he can't get there, kind of thing. So hands, people want to come off mute. Anybody with a story about access? No? All right. That's all right. We're going to talk about hospital budgeting. So global budgets are possible with the Washington Health Trust. And what a global budget does is make it possible to fund a hospital or a specialty clinic in a rural area, regardless of whether they're going to profit off of that care or not. Right now, there's a lot of for-profit companies in our healthcare space, not just the insurance companies. And if they're not going to make money, they're not going to open a clinic, regardless of the need in that community. And that sucks for people who live there. It sucks for people who drive through there. It sucks for people who want to visit the beach or the mountains or wherever you're going, right? So we can do this a lot better. This is done in other universal healthcare systems around the world. They have, Maryland has global hospital budgets and it's worked for them. Connecticut also has Medicaid on a trust. So there's components of this policy that are working globally. But there's also components of this policy that are working in our country. So we're just putting them all together and implementing together, hopefully. We also, this is a really huge benefit of the Washington Health Trust. If you've ever felt discriminated against by a healthcare provider or facility, right now with your insurance coverage, you might not have the ability to seek care elsewhere, right? You're stuck because that's the only doctor who does X, Y, and Z that's in your network. Washington Health Trust would cover everybody, all the providers in Washington and outside of Washington. So if you feel like you need to find a new doctor, you can. There also sets up a foundation for health equity that just flat does not exist in our current tiered for-profit insurance-based system. Folks that need things that aren't getting them. There's a lot of data to suggest that, you know, Black women, regardless of their financial situation, are at higher risk for maternal mortality. So even if they have money to cover insurance, they're still at a higher risk for maternal mortality. Those kinds of things aren't necessarily fixed automatically by a system that changes the billing, but it does provide space, hopefully, to have these conversations, right? To set a foundation where every service is paid the same. So regardless of your ability to have a job or, you know, your whatever status, right? It's paid the same. Doctors don't need to chase money. They don't need to chase patients with better rates attached to them. They also don't need to limit patients that don't have good coverage, right? So folks with Medicare or Medicaid sometimes have a hard time finding providers to care for them because their rates are not as high as a commercial rate. None of those games are required with the Washington Health Trust. So it creates a foundation for health equity that, again, just does not exist in our current system. And that's important. The Washington Health Trust is also good for our First people. So for First Nations folks, the trust will pay secondary to the Indian Health Services, similar to how it would pay secondary to Medicare. So federal dollars pay first, and then the trust would pay whatever that federal dollars don't pay. I mentioned for Medicare, that's eyes, ears, and teeth, right? So, and then again, for the tribal communities, whatever the Indian Health Services are not covering. We talked about equitable reimbursement. It applies to this population as well. The intent is that Indian healers, practitioners, and clinics could become community clinics and receive a global budget. So they would be eligible for some of the global budget stuff we talked about. And this is a space where we are still seeking input. It's difficult to get connections with tribes, and especially those that review policy, because they are entitled to government conversations, and that's not us, right? So connections, people to people, you know, you tell 10 people, if people know somebody who's part of a tribe, that's how we're going to get our policy in front of the right people. And it's just going to take time. And it's something we're still very interested in making sure we've done this right. And that they're covered the way that they need to be covered, and the way that they're not going to lose federal funding, but will benefit from the trust. So here we have another opportunity to share the same slide we shared earlier with all the different scenarios that are challenged in our healthcare system right now. Would open up the opportunity for folks to share if you're interested in doing so. Wow. Okay, Catherine, go ahead.
Okay. I always forget what the SDOH means. I always go to a blank. It's those social determinants of health. And I just want to share how frustrating it is with our homeless people and that kind of stuff. They come in with horrible, horrible wounds. We would spend months, you know, getting them healed up, getting their wounds, you know, almost completely healed sometimes. And then, you know, no place for them to go. And so they end up just getting discharged back to their car, back to the streets. And in 3 more months, they would come back with their wounds as bad as they were before, because all they did was sit in their vehicle, or that's the only place they had to sleep in and stuff. And it's just such a waste. And the thing that I always think of is that we have the opportunity to save so much money that with this trust, that we can put those resources into helping with getting people adequate housing, getting people adequate food security, you know, good nutrition, so that they can continue to heal, because you can't heal your wounds if you aren't eating well, you know?
Right.
And it's just things like that. We don't have to stay in this hamster wheel of not getting anywhere, you know, just by taking that money back. So from the rich. That's all I want to say.
Absolutely. Yeah, and social determinants of health, the premise there is that your mortality is predictable right now accurately by your zip code. So where you live, what environmental impacts of the area that you live, the financial healthiness of your community, all those pieces play a part. Transportation options, access to healthy food, all of those environmental factors are what goes into those social determinants of health. And they're called determinants because you can literally predict based on a zip code how people are going to do. And that's just not okay.
And
It's just
the
not
other
okay.
thing too, I think that people, they always talk about intersectionality of different things. And I think it's more than just intersectionality. These things don't just intersect with each other. They're interdependent on each other. You know, I think that that's a better term for it.
Yeah. Yeah, I've mentioned at least one of these, that my uncle that I talked about earlier, they built the brand new fancy cancer center that he received his treatment from right after they built the fracking plant, you know, at the base of the hill where the cancer center was. So they knew when they built that business that they would need to respond to the increased cancer that it, you know, caused in the environment. So yeah, and that's all about big money in politics, right? They're making money off of those, regardless of what it's doing to the planet. So and maybe that's too much for a healthcare talk, but reality is it's all connected. It's definitely all interdependent. So here's another opportunity for questions, and then we'll talk about how can you help, right? What actions can we take today? What does the next phase of this look like? And then some appreciation for folks that have helped us on the road. Any questions I can take from the audience? All right. Well, I appreciate the opportunity to get a sip of water. Oh, Kaylee has her hand raised. Go ahead.
Oh, sorry, you can sip water.
Go for it.
I was also going to add to what you were talking about and tag a question onto that. I was at the last town hall and talked about endometriosis and definitely like the gender gaps in care too as social determinants of health. And
Yeah.
I'm wondering if there are, like, when you are trying to encourage decision makers to pass legislation, um, what are some of the main points that you encourage people to make that are, it's like people should care about the the morals behind this issue?
Yeah.
Obviously, we should be giving healthcare to people, and if it's not enough for people to say, my goodness, people who are experiencing houselessness are living in their cars or on the streets and are having recurring wounds, or um, people like me became disabled at age 25 because I did not get an accurate diagnosis for endometriosis until my entire body's systems collapsed. And I'm on disability and I'm costing the federal government quite a lot of money now. And I deserve that, I believe, but if it's not enough to think about the morality, to have the financial incentives of actually arguing that this would save money, I'm so glad that you all are doing that. And I just wanted, I guess, more of like a summary of the basic bullet points of like, how are we arguing for the financial incentives, if that's the only way it's going to change decision makers' minds, to say, actually, it's going to save you a lot of money rather than dealing
Yeah.
with the crisis, doing preventative care, etc.
Yeah. And so, telling your story is what's going to change their hearts and their minds. They know the facts. They know the financials. They know this is going to save money. They know what you're up against is the power of money in politics, right? So, helping them understand that this is an issue that's big, that's impacting the vast majority of their constituency, that it will impact their ability to get to keep their job, right? So talk about voting them in, voting them out kind of thing. I think we have to be louder than however much money they're taking from the system. And it's not the facts and the figures that's going to change their mind. It's you telling your story that, you know, at 25, this happened to me, and now for the rest of my life, I'm costing the system money where I could have been, you know, a productive, you know, whatever, right? So it's you telling your story. It's all of us telling our stories and overwhelming them with the morality of the situation and the details of the situation where it keeps them up at night, you know? I think that's it. Catherine, go ahead.
I agree. That's what I wanted to say. It's the power of stories, because our elected officials already know the facts. They know how much money it saved. But the problem is you need to go to the PDC and look at how much money they are taking from these for-profit medical industrial complex people, you know? We've studied it, and it's a lot of money. And I know it is so hard to tell your stories sometimes, because they're heartbreaking, they're painful. Some people feel like it's their fault because they weren't good enough, they didn't work hard enough, they didn't have the right coverage. But it wasn't. The fact is, you're being set up. You're being set up to fail. And so we just have to really try to encourage people to tell their stories, because we have to make it really hurt for them, and also pay attention who you're voting for. Okay. So.
Yeah. Yeah, there's a Wendell Potter is one of the folks that's in the Healing Us documentary, and he used to be Cigna Healthcare's like spin doctor, right? Like it was his job to go in and like take the crazy media nightmare and spin it into something that wasn't, you know, awful and horrible, and you know, and he finally quit his job, and he tells the story that was like, okay, I've had enough. I can't do this anymore. I can't represent these insurance companies anymore. And those are the things that change people's minds. and their hearts. It's not the facts and figures. It's the details of somebody's life being absolutely devastated, or the ad nauseum of, I couldn't get the medication I needed because of X, Y, and Z, or it took 6 weeks to get X, Y, and Z. It's all of it put together where they just can't ignore it anymore, where the money doesn't overload the volume of our reality. Go ahead, Catherine.
You also don't have to give like a live testimony to the commission. You can also put it in writing. And the other thing is you can just show up to the Universal Healthcare Commission meetings. They're all on Zoom. And if you're at work, you can just go ahead and turn it on and then turn the volume down. But that shows them that people care about this. Right now, all of our politicians are saying nobody cares about Medicare for all. It's not a big issue.
Right.
Because that's what they're wanting you to think everybody else is thinking. Trust me, they're still concerned about their health care. All right.
Yeah, and enough people are showing up that they stopped letting you see how many participants were participating. So, but we have to keep on them. It's a resilience. So simple action for today, if you have not already pledged to sign our next initiative, this QR code might pop up an ad because that's what happens when you use free QR codes, but it doesn't always pop up an ad. If you get one, just cancel it. And it'll take you to our pledge to sign. You can also go to our website, and if you're on your phone, it's one of the 4 buttons that comes up. It's very nicely designed the way the website's running right now. If you are on your laptop, same idea. Go to the wholewashington.org website, and the buttons are at the top of the page. Pledge to sign. I'll leave that up long enough for folks to use it. This gets you into our system so we can find you. Initiatives in Washington State. One, it's cool that initiatives are possible in Washington. Not all states have this opportunity to access direct democracy, right? That we can participate in making stuff happen, both inside and outside of our legislative process. That's pretty cool. But they don't make it easy. It has to be a ink signature on a piece of paper that has the entire initiative language printed on it. So it's expensive to print them. There's 20 signatures per page. And we have to have a way to find you so that you can sign it physically. And so that's what this pledge to sign is. We're using the pledge to sign as kind of part of our go, no-go criteria. So we don't want to just collect 100,000 signatures every time and never get there. We would like to get it done and be successful. And so we're doing this as kind of pre-work to set ourselves up for success. The Town Hall Roadshow, the pledge to sign. We're going to talk about lots of other ways to get involved. All of this really setting ourselves up for success the next time we run an initiative. So the number of pledges that we have will go into letting us know if we're ready. Collecting signatures can be kind of a burnout factory. It's exhausting as much as it's fun and rewarding. It is super exhausting. So folks need to be prepared, and we also need to be able to find you. So pledge to sign. This list of things is on our actions webpage. So if you go to www.wholewashington.org/actions, you'll get all of these things. We'll also send you the slides, and all these links are live links. That pledge to sign we just covered. You can subscribe to our newsletter. It comes out twice a month. We try not to be obnoxious with emails. Could sign up to volunteer. Volunteer means lots of things. It does not just mean signature gathering. Not everybody likes to do that kind of thing, but we need data entry. There's, event planning. There's making phone calls. There's, what else? Sending text messages. There's, oh my gosh, all the things. Like, it was really helpful to have folks just handing out flyers at different events leading up to our town halls. It's just anything we can do to get the word out about who we are and that we exist. The next time I go collecting signatures, I would much rather say, I'm Carrie from Whole Washington. They're like, oh my God, I know that, who you are. I'd love to sign it, right? Versus what's Whole Washington, right? So all this pre-work, there's a lot of different ways to get involved. We'll talk about some more in a minute. Find us on social media. We are on all of them in some capacity. Find your favorite one. Help us get the word out on your favorite platform. We're even on Discord and Threads and all kinds of stuff. You can attend, host, or help plan an event, movie nights with the Healing Us movie, presentations like this. We've taken these presentations to different organizations. So if you belong to a club or whatever that meets regularly, get us on the agenda. We'd love to come present. Doing a coffee with the league it's in August. I think it's next Tuesday. We've done some indivisible groups. We've done some Kiwanis type, those type groups. We'll talk to anybody. So if you're in a group who has a meeting, let us know. We'll come. You could donate. Nothing happens for free. I mentioned petitions. Printing is expensive. All the lit and flyers and stuff is expensive. Event space is expensive. So we can't do any of this without some kind of donations. Catherine, if you've not put the t-shirt order form in the chat yet, maybe now's a good time to do that. I think Catherine and I are both wearing our Whole Washington t-shirts. It's pretty cool. On the front, it's got the road trip logo. And then on the back, Catherine's showing the back, it's got all the places we visited. It's concert t-shirt style. It's super good. I love it.
I think Mike had a question.
Sure. Mike had a question. Go for it.
I did just want to say one thing. As you know, I'm running for legislator in District 19, and Whole Washington and universal health care is the #1 thing I'm running for.
Who are you running against?
Jim Walsh.
Yeah. Thanks for running. Jim Walsh. We don't endorse candidates, but Mike has endorsed us. Thank you, Mike. Jim Walsh is one of the sources of that type of misinformation I was talking about earlier. So I don't mind just addressing that. It's a good, thank you for running. What else? We did part of our road trip with Washington Physicians for Social Responsibility and a coalition of other organizations. That series was called Healthcare Not Warfare. There are some recordings on our Facebook page if you'd like to see it. Same idea. We talked about the Washington Health Trust, and then WPSR talked about the fact that there's also tons of money in our military budget that we could be spending better. And one of the pieces of that was a collaborative fundraiser for undue medical debt. Whatever money we raise in that fundraiser, they can buy medical debt for pennies on the dollar. We looked at it earlier. It's up to $2,000 of our $10,000 goal. So right now, with $2,000, we can eliminate $20,000 worth of medical debt for Washingtonians. If we meet our goal of $10,000, then we can eliminate $1 million of debt, if I remember correctly. It's like 100,000. It's 100. I think I might have done the first one wrong. It's $100.
$1 wipes out $100.
Yeah, that one. So it makes a huge impact is the point. I'll do my math better next time, but it makes a huge impact. If we reach our $10,000 goal, we can wipe out $1 million of medical debt here in Washington. So that's huge. That's it's going to take a while to fix the system. In the meantime, people are still racking up debt, which is stupid. So how do we help, fix that? Somebody pointed out it is just a Band-Aid on the system. That's not going to fix anything, but I think it's really important to do both, to relieve people's suffering immediately and then also try to fix the system so we don't continue to create medical debt. We've talked a lot about the commission. There's links here to give public comment. You can do that in an email. It also takes 90 seconds to give comments live. You can call and write your representatives at any time. You can say, hey, I heard really cool things about the Washington Health Trust. Why hasn't it gotten a hearing? Like, what are you doing about it? Anytime, all the time. The commission is just one route. If you like the idea of following the commission, you can subscribe to their announcements, so they'll send you meeting reminders. I mentioned earlier, I also volunteer for National Nurses United. They have a Patients Over Profits pledge that's linked here. You can also just Google Patients Over Profits, National Nurses United. The idea there is that someone would sign that and pledge to not take more than $250 from the medical industrial complex. And why do we care? All that stuff we talked about earlier about the impact of big money in politics. And if your politician's going to do what's in your best interest, it's going to be best if they're not taking that money. So that's what that pledge is about. The Healing Us movie is also linked here. I can't say enough good things about Healing Us. When you leave this space, you're going to want to inoculate yourself against misleading ads, those hit pieces I was talking about earlier. There's going to be a lot of folks with a vested interest in keeping the system the way it is. Dr. Hugh Foy spoke for us in Seattle. He called this the modern day gold rush, right? People are making money hands over fists from our medical system right now. Pharmacy benefit managers, insurance companies, big pharma, et cetera, et cetera, et cetera. And they are going to scare you into keeping it the way it is. And so when those ads come out, Colorado collected enough signatures to get on their ballot, and they got totally beat down by millions of dollars in attack ads from all those, corporate interests I just talked about. And a lot of their talking points was like, it's going to get worse. Wait lines are going to get longer. It's a socialized medicine, and can you trust the government to run your healthcare? And so knowing that single payer healthcare is not socialized medicine and the differences is super helpful. I love the analogy of talking to it more like it's a farmer's co-op, whatever works to help people recognize that it's not scary. And the government's not running it. Your doctor is running it. Your doctor's running it in a way that they're not right now, right? It's not Medicare Advantage. Medicare Advantage is a privatization of Medicare. It's the insurance companies siphoning money out of the Medicare pockets. So just things to think about and have in your back pocket. I mentioned social media. These are links if you want to find us that way. And then there's a couple slides of just thank yous. It was a lot of work to get this road trip going and to keep it moving and to have places to speak and to have audiences to talk to. And so really just wanting to recognize the folks. Some of them are here with us today. I think I saw Rena come in from Aberdeen. She helped us organize, do some tabling with a union event on May Day, which was cool. And we did a presentation in the Aberdeen Library. Micah's in the room. She supported us doing both a Castle Rock Town Hall and a Longview Town Hall on the LCC campus. She also helps with our fundraising stuff. She's awesome. Anyone else on this list that's in the room? I don't know. With huge thank yous. You can see all the organizations that helped us. So again, just if you recognize like, oh, hey, I'm on the Rotary, we've only talked to the Rotary in Vashon. We could talk to the Rotary in every other section of the state, potentially. It just takes someone to make that connection for us. I do a lot of what I call throwing spaghetti against the wall, where I'll email the entire list of NAACP groups and maybe 2 of them will email me back. If I have a warm handoff, it's a much more successful connection. So just keep pushing on that. OMAC was great. Christy and OMAC, there were like 30 people at an OMAC town hall. I was absolutely amazed. Aberdeen was one of the biggest as well. Like to start off with, Aberdeen had 20 plus 30 people there. We had to get extra chairs out of the closet. It was amazing. It makes a huge difference having somebody local helping to promote and make those kinds of connections. So now that we've done the thank yous, not enough of them, but I can't, we'll be here all night. We're going to talk about what we're doing from here. So down the road, August, we're taking a little bit of time off. We do have a couple presentations scheduled that, you know, tacked on, but it is campaign season. So really want to emphasize the importance of voting and knowing who you're voting for. We do have an endorsements page, but that's not going to cover every race. So do some Googling. September, we're looking at starting connections with college student groups and doing some presentations on college campuses. Again, that's going to be far more successful if folks are able to connect us with important people in those spaces. We're absolutely available for organizational presentations. I think I've mentioned that several times now. We will be taking what we've learned and updating the legislation and the initiative language. There is still some time for feedback. We typically meet quite a bit as we go through that language. It's dense. But if folks are interested in participating, those are often on our calendar. They're public. We do all of this stuff with full transparency. And you can email us with feedback. If you don't want to participate in the meeting, we can take it in email, info@wholewashington.org. We will be identifying legislative champions. We would love to see more folks co-sponsor the Senate bill that will be introduced again. We would also love to see a bill introduced in the House. A companion bill often makes a little stronger situation for bills to go through. I see Catherine has her hand up. Go ahead.
I just wanted to say regarding the updating the legislation and the initiative, because I see some really bright people in here. And to get you thinking, we've been doing some thinking about, does the legislation and the initiative have to do they have to be exactly the same? And could
Right.
there be some strategy into making some slight differences between an initiative and a piece of legislation to hopefully try to encourage them to pass this through the legislature? So really hoping to have some conversations with people who are into that kind of strategy thinking in the next couple of months on how we can best use that to our advantage. Okay.
All right. And the reason why we're going through this slide is to just emphasize that there are so many different ways that we need help. And so trying to help volunteers find their area of expertise or their area of interest and plug into the campaign, super important. We're going to need small businesses to host petitions, and that conversation should start right now. You know, it's more successful if we have some more time. I mentioned we're going to start reaching out to the Chamber of Commerce. I know those can be typically a bit more conservative, and I think that's okay. Healthcare is an everybody issue. Our small business case is good, so we're hoping to have some success there. Warm handoff is always better. So if you're a member of your chamber, if you know somebody who attends the meetings regularly, you can get us on an agenda. It so helps to have a foot in the door. There's a lot of fundraising opportunities. The fundraising team meets every other Wednesday at 4 o'clock. We're also have some expertise hunting down foundation opportunities. So if that's something you're aware of, it's going to take at least a few $1 million to win this thing. So just the reality, and that is not what's in our bank account right now. So Whole Washington would love to pay some staff that takes monthly donations. To build a budget, you know, requires a steady stream of even small dollars. So I think that's everything on this slide. Tabling events, we have kits available. If you have a community event where Whole Washington's information could be shared, we need help staffing those kinds of things, but also we have some resources. So lots of ways to help us. Hopefully you're motivated after tonight's presentation, and we would love to find a way to plug you in. Any questions about how to get involved or where we're going next, or any ideas that you don't see on this slide that we should be considering, feel free to speak up. All right, it's been a long one. The slide is the longest presentation we've done. We tried to pull everything in from the whole journey. So appreciate you hanging in there and giving us a little bit of extra time tonight. Especially right at dinner time. Really appreciate it.
Thanks, everybody, for showing up. We really appreciate it. And last minute, if anybody wants to do a parade in Seattle, I forgot I signed up for it. It's this Saturday from like 12:30, probably only for just an hour or two, okay? It will be fun. Especially if we can get lots of people out there. I'll deliver you your t-shirt there. Okay.
Nice. All right. Well, again, really appreciate your time tonight. If you think of anything, you have our contact information. Appreciate everything. Just being here is huge, and hopefully it'll spread.
Yes.
All right. Thanks, everyone. Good night.
Good night. Woo. Hey, Mike. Oh, he's gone.